Call him right in the head. I'm going to go ahead and call our health committee to order. I'd like to welcome you all, and hope everybody had a good lunch. Let's stand and we'll have our invocation. Audrey, would you lead us, please?
I would. Yeah. Come on down, please. Dear Heavenly Father, we just thank you for another glorious day that you've given us. We ask that you be with those who can't be with us today. Provide strength and healing to those who need them. We ask that you be with us throughout this meeting as we do the work for our people. Help us to make good decisions. We ask that you forgive us of our shortcomings, Lord. And we thank you so much for the blessings that you bestowed on each one of us. We ask for traveling grace today. In your heavenly name. Amen.
Amen. Thank you. Roll call.
Joe Crittenden.
Here.
Linda O'Leary. Joe Anglin.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Arthur Connor. Meredith Bailey. Here. Don Garvin. Chuck Hoskin. Bill Johnson. Taylor Keene.
Here.
John Keener. Jack Bob Martin. Mel Bryan Shophouse. David Thornton. Carol Town Watt. Phyllis Sargent. Okay. You got one.
That's four. All right. Hallelujah. Next on the agenda is approval of the minutes for May 15th. Have a motion and a second. All in favor, aye? Aye. Opposed, same sign. Mr. Baker?
Mr. Chairman, this time I would like to amend the agenda to have an item of new business. Apparently it is time sensitive, and it's sponsored by Chuck Hoskin and Joe Crittenden, authored by Melissa Gower, and it's a resolution approving and authorizing the submittal request to the Indian Health Service to participate in the 07 IHS Joint Venture Construction Program agreement for the construction and operation of the Bonita Healthcare Facility. And I'd like to move to amend the agenda for this item.
Have a motion. Do I have a second? Any discussion? All in favor, aye?
Aye.
Any opposed? Okay. Agenda is amended. We'll move on into reports now. Blackmore Service Unit is up first as usual. Welcome, Jim.
Well, thank you. OCO. Nice to be back. On services, we have 2 latent positions that are rotating in on TDY to help fill our OB/GYN vacancies. We have 3 vacancies right now. Since their deliveries in that service unit are being outsourced out to, and I said Comanche Memorial. That's not. Yeah, it is Comanche Memorial. I am correct. Okay. We have a chef case manager that we put on this last year, and she was able to identify 27 chef cases totaling around $500,000, and we go forward in our quest for EHR, and we bringing the dental workstations up to speed, and we trained our Lawton physician about our EHR. On our let's see, what else did we do? Looks like our occupancy rate is at 38%, and then you have your stats. New charts are down, newborns are down, and outpatient visits are down. Must be getting close to summertime. PC backlog, we've worked on that diligently, so we're able to continue on with our development of our ChargeMaster, electronic ChargeMaster. The Medicare, Medicaid, the third-party collections To date, are $7.5 million, and we're shooting for $12 million for the year, and so we're a little bit below where we want to be, but I think that we're going to hopefully make a surge before they close the books due to UFMS. And I think in Ed's report, he's got a whole section on the UFMS, the Unified Financial Management System that is being implemented within the Indian Health Service. So I won't steal his thunder. The percentage of our accounts receivable is 2%, which is very good for the area and for us. And we are getting ready to implement UFMS, a new financial system, and so we're moving all of our accounts to the proper places in this new system. I trained over 300 folks of our staff in IHS 101, which is a history lesson for Indian Health Service, which goes along with our succession planning efforts. And I found out at the Triad meeting that Hastings is developing the remainder of it online, so that's going to help us meet our deadlines. Again, I won't steal all of his thunder. And we do have 3 OB/GYN physician vacancies. The vacancies are in there. There's a 3 initiatives integration forum, June the 21st at Moore Norman Technology Center in Oklahoma City, and then the area award ceremonies again this year on July the 26th. Our housekeeping project is completed, and our new dock leveler came in, and it works very well. And so we now have the space available behind the emergency room to start designing the emergency room, the next phase, which would be the expansion of the emergency room, and to enable us to have better patient flow. So we're looking forward to that endeavor. I'm working with the area office on our OB/GYN services and working up a business plan. And the last little segment that I'm working on is outsourcing, the possibilities of outsourcing and the pros and cons and that sort of thing. And then I'll be presenting that to the area director in July and get some feedback there. And it's our evaluation time, so all of the CEOs are going into the area office within the next couple of weeks and get our midterm evaluations and directions for the remainder of the fiscal year. We have a lot of challenges that are coming down, a lot of new systems that are coming down, and we hope to address those and meet all the timelines. Questions?
Any questions for Jim? No questions.
What else?
Thank you, Jim. Next, we have Mr. Ed McLemore of Hastings Indian Medical Center. And pardon me. So, is that fine still $500
Which one?
for your phone going on?
Yeah, I guess.
Okay.
Who's calling on?
Go ahead. Mine.
Good afternoon, Mr.
Good afternoon.
Chairman, committee members. I've just been admonished to speed up the process here of reporting by my good friend. So I'll do that.
Cái lệ nó Sài Gòn rất hỏi ghê. Con mà lấy nó.
¿Cómo? Eso huevo tiene nada.
Just a little slower, Gail's having trouble transcribing.
I've handed out a report, this monthly report. In the first page of that report, you'll see our funds status report for the month ending May, year-to-date ending May 31st. The funds available, far right-hand column, about two-thirds of the way down the page, we're showing a $2 million positive fund balance at the end of May. We're projecting about $2.7 million if everything were to hold steady, extrapolating those collections up through May 31st through the end of the year. We do have a little bit of work to do with the Maintenance and Improvement Fund, the Dot 26 sub-activity. You'll see a little bit of a deficit there, $101,000, but I don't think we've actually received all of the money in that line item. But Hastings is in excellent financial shape at this time of the year. We're a lot better off than we were at this time in years past, some years past. We are looking at about $33 million in total alternate resource collections this year. About $33 million. That's about 13% increase over last year. And all of that goes into direct services. As we've said before, we operate on about 60% of our budget on alternate resources. Those monies we collect from private insurance payers. When patients come in, we ask if you've got insurance or if you have Medicaid or Medicare, and if you don't, then we ask you to go visit with our patient benefits coordinators to see if you might be eligible for something. And something the governor recently signed will help us even more, I think, because as I understand it, the Medicaid and Sooner Care eligibility increased from 185% of the federal poverty level at about $37,000 for a family of four up to $60,000, which is about 300% of that poverty level. So we think there's going to be a whole bunch, especially kids included. They estimate about 42,000 additional kids throughout the state of Oklahoma will be eligible for Sooner Care, and that in turn will help us with that increase in collections. The next page, we've been asked to help the area office with clinical applications coordination, the implementation of the electronic health record throughout the entire Oklahoma area. Our clinical applications coordinator up here, Tony Potts, has been designated as the acting area clinical applications coordinator to help all the other service units with their EHR implementation. And that'll be part-time. She's still going to be here. She'll work for us, but she'll devote some of her time to the area activities. Health fair, we had a big turnout there. We had some discussions with the VA. They have a continuity of operations communication system that they've used successfully, and they demonstrated it for us, and we may be able to maybe consider buying one of those. It's a $100,000 unit, but it will keep operations going, communications, and also access to the electronic health record. And so once all of that stuff is activated, then people will walk into a mobile clinic or whatever is set up and have all their records immediately available to the providers there. We're going to have some mandatory training for all of IHS, and there's some things, it's just considered to be basic fundamental areas where all employees should be trained, customer service, communication, that sort of thing. The next, and we can probably skip over page 5, at least the bottom half of that page, at least the left half of the bottom of that page. You know, we tried to give blood, but they seemed like they only found ice water or something in our vein. You know, we did
it out of fraternity.
We actually donated blood. I think they got 39 units collected, and they said they had 25, I think, as a goal, and so we did our share of. That is, if they could even use that. Let's see, anything else in, tech news on page 8. You know, we have a lot of activity going on. Intranet update. We've got the training we talked about, the 7 modules that Hastings is developing for the entire southeast region of the Indian Health Service, which includes the Nashville area, Albuquerque, and Oklahoma City areas for that online training. Mitch Thornbrew and his team are actually developing that online accessible training for all of Indian Health Service in those 3 areas. We have a lot of expertise here at Hastings in IT. We talked about the area clinical applications coordinator. People are recognizing that the expertise is here at Hastings, and they're accessing that. I don't know that we're getting any return on that at this point, but we're certainly contributing to the technical availability of those systems. We'd like to invite all of you all to come up to Hastings on Thursday, if you're around. Starting at about 11, we're going to have a cookout. It's an annual employee cookout, and you're certainly welcome. You know, it won't be a hog fry, it'll be hamburgers now. So, you all... All right. But you all can come up Thursday the 14th at about 11 o'clock. We usually start serving. So if you would have time. And on page 11, there is a description of the Unified Financial Management System. And it's just a new system of financial management that the entire Department of Health and Human Services is going to convert over to, and most of the other agencies have done so. IHS is the last one in line, and as a result, most of the training money has been spent, and so those of us who are last to get all of this stuff done, we've got to get all of our training done by September the 15th, because we go live at the start of October with the whole new financial management system. It'll do away with a lot of our subsystems that we're used to using in the Indian Health Service, and it'll give us almost instantaneous financial reports all the way up through the department. If they want to know what Hastings' financial condition is at any point, in theory, the Secretary of Health and Human Services, Mike Levitt, could access information related to Hastings. So that's pretty much my report. I'd be happy to answer any questions you might have.
Any questions for Ed?
Yes, sir.
Yes, Mr. Keener.
God.
The blood, the color suit, huh? Just go ahead.
Not anh đi gần đây.
Còn thật ra nó sẽ là lý do từ sinh hospital.
I dig old who's the hell?
Did you get all that?
Got it all. Got it all. No, I asked him, I said, had they used the blood that he had given? And if they has, then if I need it, I won't be afraid to go up.
I don't know.
Oh, okay.
Any other questions? Done a good job.
All right.
Thank you, sir. Nothing like going to a mid-year review with money in the bank, right, Ed?
That's right.
Next, we have Melissa Gower, Cherokee Nation Health Services. Welcome.
Good afternoon.
Afternoon.
Cherokee Health Partners performed 116 procedures for the month of May with an estimated net gain of $14,000. We continue development on our PACE program. We've hired a medical director that begins on July the 9th, Dr. Douglas Young. And we have been interviewing for the administrative director on that program and have not selected one yet. Our building is coming up. If you haven't been by to see it, you should do that. It looks very nice. It's on 4th Street on our Marcoma property next to Gower Village. Our application is in Baltimore at CMS. They're reviewing it. They have 90 days to do so, and we plan to open in January. Continuing to work with C&B and Mr. Carson on health business development ideas. And we have started a transition plan implementation meeting that we're doing for Muskogee and Nowata for the moves to make sure we have everything coordinated and ordered and grand opening scheduled and all of those kinds of things. So we've been doing that for a couple weeks, and we're going to continue to do that on a bi-weekly basis until we complete that process. Salisol, the flooring and the painting are almost finished. We'll be starting to install equipment there in about another week and should be ready to start moving by the end of the month. Nowata, we're completing the sheetrock there, and it's moving forward nicely. Muskogee is on schedule. We're currently ordering equipment. It's almost dried in. All of the columns on the outside are done. We should be starting to put up that glass next week, and working on the sheetrock on the inside already. We have all of our pictures and art for both Nowata and Salisol done, and continuing to finalize Muskogee. We have now completed our cost estimates for Salina Dental Addition and the new Jack Brown Center, and have forwarded those to be included in the Cherokee Nation Capital Improvement Plan. We have been working with Choctaw Nation on different health issues and have built a collaborative effort with them. We're working with them on a relationship with Sparks Hospital in Fort Smith, and we're going to continue to meet with them, each tribe hosting 1 month, and then we'll host the next month. We've been also working with Mr. Carson at C&B, setting up Cherokee Services Group, and Health actually just did our first test consulting agreement with them, and it was very successful. For the month of May, we imaged over 200,000 documents that we scanned and imaged for that month. We've submitted our FY08 budget request, including our revenue projections, to the finance office. Our electronic health record project is moving forward nicely. We now have our what they call CACs, which are clinical application coordinators, on staff, and Hastings has been assisting us with training them since Hastings has already gone through the EHR process. So we're working nicely as a team on that project. We just celebrated National Nurses Week and Women's Health Week, so you probably saw, if you read your email, you probably saw a bunch of stuff we sent out on that, and we had several events on it. We're continuing on the implementation of our chronic care initiative. We're very excited about that initiative and think it's going to be a very good thing for the health care for our Cherokee citizens. We also met with the Arizona School of Dentistry and set up some clinical rotations for them, so we're trying to get some more rotations coming through our facilities in the different professions. We have a couple openings. We have an opening at Salisaw Clinic, and we just filled a position opening at Stillwell Clinic and a position opening at Muskogee. Probably my biggest announcement today is that I've told you that we've been arguing, I guess you could say, or negotiating or working with Indian Health Service on getting our staffing dollars for Muskogee for 07, and we have successfully done that now. We received it yesterday. So we're very happy about that because we had numerous professional staff that we needed to sign or we were going to lose them. And so we've been able to do that, and I'm very happy about that. Makes me feel better because I know I can pay them bonds now. Our diabetes program, of course, we work with Hastings on their new...
Mr. Baker's got a question.
Yeah, I do. On the PACE program, the CNB is building the building for us.
They loaned the money to build the building, yes.
Okay. And we're going to pay them a 10% return on their investment.
I'm not sure what the terms
Well,
of
that's
the
what they're
agreement
saying.
are.
That they're going to make a 10% return.
Okay.
And that's a good business deal for them.
Okay.
My question is, why would that be a good business deal for the PACE program when we could go down and borrow the money for 5.5%, 6%?
I don't know that. I can ask Kelly that.
Okay.
She's the one that helped facilitate that.
All right. It seems like it's in our own best customers not to really.
The diabetes physical therapy building at Hastings, of course, we've been partners with them on that, and we have ordered the diabetes equipment there, and it will be delivered in the next few weeks. We've held several diabetes prevention program screenings, community screenings. Held one at Greasy, one at a housing authority office, at the Women's Health Fair. Had a lot of people attend those screenings. Had actually 166 people, and 81 of those were eligible for that program. So we're excited about that because that helps in the prevention of diabetes, which is what we're all about in trying to help our citizens not develop the full-blown diabetes. We have finished 5 of the 9 course sessions in our diabetes program. We have 9 active participants in that particular program, and to date they've lost 45 pounds, and actually one of those persons has met their 7% weight goal, so that's very good and success. Thank you. And they're actually participating in the Huckleberry Festival that's going to be at the end of June. Our Jack Brown Center is getting ready for a review of their CARF accreditation, as well as our EMS program getting ready for their CAS accreditation review. Muskogee Clinic, we had our regional clinic director there, Rhonda Cochran, who was reconfirmed by the Senate in the U.S. House for the Oklahoma State Board of Licensed Alcohol and Drug Counselors. So we're proud of Rhonda to be nominated and appointed to that board. We held a job fair at Muskogee on May 17th. don't know if Diane's already been here or not, but I'm sure she reported on that. But we had probably about 500 or 600 applicants. It was a very successful job fair, and it actually is helping us fill some other positions we had not at Muskogee. So that was very good, and we were excited about that. The staff at Muskogee Clinic walked in the Relay for Life and raised over $1,000. Our clinic administrator at Nowata, Bartlesville, and Bonita has been very active in the community there and attended a JOM banquet for the Bonita area schools and several other things. He's listed about 10 things, I think, in that 1 month that he attended in the community on behalf of Cherokee Nation. So it's nice to have those presence in those activities. We at J Clinic, you guys probably already know this, but we had electrical motor outage there and was closed for part of a day until we got that. But it all went well, and our policies and procedures for that kind of an issue was followed perfectly, and they worked well. So that was nice. We have 1,387 active members in Wings and had about 10 events in the month of May with as much as 8 to 134 participants. Had 6 smoking cessation courses with 22 participants. We currently have 12 active SWAT teams in Adair, Cherokee, and Mays counties that are ongoing. We granted 17 schools in the Cherokee Nation area, jurisdictional area, grants to work on school health indexes for 2007. We sent out an RFP and schools applied for that, and we were able to fund all the schools that applied, so that was nice. We conducted a youth risk behavioral survey in 4 area schools. Our residential camps, even though, the first week there was a lot of schools that wasn't out, we still had fairly good attendance that week, and the next week we had a waiting list. So it was successful. We had 154 participants. And also the grants to the schools were for the day camps that are ongoing. I think I gave you a list of those last time. We have, under our STEPS grant, we have been involved in writing a Cherokee Challenge Youth Physical Activity curriculum. It's a very good curriculum. I read it on the plane, and it's very nice, and I'm excited about that, and we're going to start disseminating that to schools in August to help them with their fitness and their physical activity. Community health nursing had about 240 community health visits. EMS had 315 calls. Jack Brown has 19 clients at the moment, and behavioral health staff saw over 6,400 people in the month. You have a chart on the visits and the charts and those kinds of things. Our dental assistant training program had our first graduating class on May 17th. And we're working to get them on board with us. And then I saw somebody had I think it was you, Meredith, that had the flyer for the next class that's coming up. So if you know someone that's interested in that. I also attached a health policy update with numerous things that we're working on at a policy level. If you have any interest in helping with any of those, we'd love for you to do that. Dr. Charles Grimm has been nominated by the President to serve another term as Director of Indian Health Service. He's a Cherokee citizen, and we're working to ensure that nomination goes through. The appropriations for Indian Health Service, of course, at the committee level hasn't increased, but you never know what's going to happen when it gets through. But we're excited that there is an increase in there. Working with CDC on numerous issues that we have with them, the reauthorization of the Indian Health Care Improvement Act, and the Special Diabetes Program for Indians. The reauthorization for that is coming up, and it's critical that we get that reauthorized, or it could be devastating for us. And then there's some Oklahoma initiatives that we've been working on in a calendar. And then you can see from our revenue analysis that for '07, we projected $15.2 million. Our annual budget for '07 was $12.8, so we're looking at coming in about $2.5 million over what we budgeted. So we're happy about that, and we continue to try to streamline our billing process and improve that. For the month of May, for contract health, we processed 2,620 referrals, which was our all-time high for a while now. The total cost was $1.55 million. We approved 2,415 of those at $937 million and denied 205. And the last thing I wanted to announce is that I don't know if some of you came to the all-employee picnic Saturday, but I wanted to say that, you know, there's 10 attribute awards and then an Employee of the Year award. And out of those 11 awards, health won 5 of those. And so I'm very proud of that. Terry Ross, who's the clinic caretaker at Salisaw Clinic, won the Employee of the Year award. Brett Hayes, our Director of Contract Health, won the Respectful award. Jennifer Scoggins, the Assistant Clinic Administrator at Salisaw, won the Leadership award. And Tina Snell, who's an RN at J Clinic, won the Self-Confident Award, and the Responsibility Award was Debbie Hood, who's a clerk typist at Community Health Nursing at Hastings. And that's my report.
Phyllis, you first.
Melissa, a couple of things. The fitness curriculum that you talked about giving out, could I get a copy of that as well? Because a lot of times, if it goes to the schools in my area, they'll call and they'll want to know.
As soon as we finalize that, I'll make sure everybody gets a copy. It's pretty thick, but maybe we can at least email it out or something. It's a really nice curriculum.
And the other thing is that, thank you for referring a couple of my calls to Brett Hayes. He was very quick about responding to those, following back up with me, and I really appreciate it when I know that something has been done on, on this end, because the people themselves won't call back if they do or do not get service sometimes. So it's good to know he did call back. Thank you.
Other questions or comments? Good report, Melissa. We have no old business on the agenda. We have a new business item, number 1, and it's the...
Move for approval.
That was quick. I was going to let Melissa get up here and tell us about it. I have a motion to approve and a second. All those in favor?
Aye.
Any opposed? Great. Any announcements? Nothing that I know of, other than next meeting is July the 17th at 1 p.m. I would entertain a motion to adjourn and second. All in favor? We are adjourned.